Hey, so this is day one after my, what they call bilateral brow lift. So on both sides, direct lift where they remove a flap of forehead skin just along the edge of your eyebrows on both sides. This side of my face was crooked. My eyebrow had dropped, well over a quarter of 3/8 of an inch relative to the left. So I've done this. And then this is all puffy today because of the surgery reaction, but I had a big bag of skin that was hanging over my eye and driving me nuts. I was sort of shaded, lost some of my peripheral vision. So this is performed in Vancouver, Canada by Dr. Peter Dolman, and it's free because we have an amazing Canadian healthcare system. But this video is applicable to anybody. So what they did, I actually put some EMLA, some topical numbing agent on my brows for about an hour before I went in, just to reduce the pinpricks. I did it under a local, so probably a dozen injections on each side, relatively quickly done. Speaking to Dr. Dolman, what happens is when the needle goes in, it's not the needle itself, it's the injection of the anesthetic that you'll feel. So it has sort of a bit of a burning sensation down deep. And then they go and they remove the skin, and then sort of on a wedge basis. So it's sort of, see if I can find my hand in front of the mirror here. Where is it? Oh, never mind. They'll pinch it like this. So they cut in at an angle and then they close it. And it goes pretty quickly. I was in and out in an hour. Once I was frozen up, I didn't feel any pain. And I tried to sleep at a 45-degree angle last night. A little bit difficult because you slide down. Icing it every so often. I will start icing it more today, given that I've got the swelling. So we'll see how it goes. I'll dig up some photos of my face prior to surgery as well and post that in the video. There you go. So here I am, 48 hours, day 2, and I've lost a bunch of the swelling that was in my eyebrows and upper eyelids. Some of that swelling is migrated down here. You can see I've got some bruising. I'll close my eyes here. More on this side, obviously. I'm feeling better though. Yesterday kind of like, you feel a bit beaten up. Tried to keep going, doing my regular routine, but I just did feel tired and kind of wonky. Today I'm feeling a lot more like myself. No real pain. I had a proper shower today and I gently massaged or scrubbed the suture line to get rid of the dried blood. And I don't get the stitches out for another week and a bit, but it looks better already just not having the dried blood there. And if I wear sunglasses, people can't really see. They can sort of see the sutures, but it's not going to be quite as bad. So I may be the stealth midnight guy with my sunglasses for a while. Anyway, there you go, day 2. So this is day 3. And you can see that most of the swelling, inflammation in the eyelids is all drifted down here now, and I've got sort of these loose bags of fluid under my eyes, and then I've got the bruising drifting down. Generally speaking, feeling better. I've been just rinsing gently in the shower in the morning to get the remaining little bits of blood off the stitches, and then they kind of already start to be a lot less noticeable, which is good. I'm feeling, again, a little bit better today. Yesterday was a transition day. I think day 1, the first 24, 36 hours I just felt really kind of slow. And today, I'm feeling pretty normal. Just I feel a little bit of tightness in this area here. No pain really. I woke up in the middle of the night and I whacked my this area here, and it was like, ow! It still hurts a little bit this morning just from where I hit it, but it didn't start bleeding, which is good. So, it's probably gonna take 2 full weeks for the bruising to go away. So I think I'll be the sunglasses guy for, you know, a good part of this. Day 4, and swelling's dropping a bit more, almost gone, I think. And we're seeing the bruising. It's now darkening in color, so it's going to start going through that process of slowly getting eliminated. So I think it'll take several more days. Yeah, so day 5, it's not so bad. I've already got some fading on the bruising, and yeah, so I'm excited. I thought it would take another few days, but I'm starting to see it fading slightly. So day 7, you can see that the bruising is fading pretty quickly now, and so I'm really happy. Yeah, I'm gonna just keep the scarring to a minimum by keeping it moist, there's some gels that you can apply with silicone, but for now I've been using the doctor prescribed. It's a combination anti-inflammatory and antibiotic, and I'll stop using that today at the end of the 1 week. This is day 7, and then I'll switch to something else. So I'll talk to the doctor about what to keeping it moist seems to be the best way to keep scars from being too noticeable. Anyway, super happy because 1 week swelling's down to 0, and just working on getting the rest of that color back to normal. So this is day 9, and you can see that the swelling is pretty much going down, and I am looking forward to getting the stitches out later this week. But yeah, it's my face is straight, my eyebrows look much better. Not my eyebrows, but my bags under my eyes are lifted up, and yeah, I'm starting to feel great. So happy. So here we are, day 14, 2 weeks ago today. I got the surgery done, and I had the stitches out yesterday. So you can see that I guess the area is just a little bit pissed off from having the stitches yanked out, but it'll settle down. And the surgeon did say that in 2 months we'll have an update, and if this bags of flesh here are a problem, then we can trim them a little bit as well, now that the eyebrows and the forehead and everything is aligned. So we'll see how long it takes for those scars to heal up and how much they disappear over the next couple months. Yeah, so here we are, week 3, and end of week 3. And so more fading and healing, a little bit of neuropathy, a little bit of feeling sometimes of some pain running sort of up here, and then pins and needles along there, depending on things. I'm being super active, probably more active than I should be, but I don't think it's hurting me. Some websites suggest that you don't do anything for 6 weeks, but I've been doing lots of cycling and lots of physical activity. But anyway, I can't see the connection to why that wouldn't help me heal rather than hurt. But so carry on. I'll give you sort of one snapshot here on every week for a bit longer, and then every couple of weeks, and then after 3 months, I think this video will get posted. So this is 4 weeks, and I am starting to see a little bit of fading. Definitely the red lines for the surgery, you know, the scars are still visible, but things are settling down, the neuropathy is settling down. So yeah, it's not so bad. I'll do one again at 2 months and one again at 3 months, and then I'll publish the video. So here's 2 months out, and the scarring is starting to fade. The only thing that happened in the last month is it turns out there are dissolvable stitches that my surgeon used, and a few times they were sticking out little thin strands, and you had to just sort of pull out. But I did have on this side here an infection that developed, like a pimple full of pus and a little bit of blood, and I'm not sure that was because of a dissolvable stitch, but just it was an area that was getting sore, and there's another area here that wasn't seeming to heal. So I started using the medication, which is a combination of an anti-inflammatory and a antibiotic, and it all settled back down. So, and I'm using bio oil, whether or not that makes a difference or not, to see if the scars helps with the scars fading. So yeah, it's starting to get better. I'll do one more video at the 3-month point. All right, and this is 3 months. So again, continuing to fade. Talked to my surgeon about it, and he said that it'll continue over the next year, but this is the main improvement is the first 3 months. And I'm gonna get these hoods addressed by the same surgeon in the next few months as well. All right, good luck to everybody.